Check your weapons at the door. It's the Medicare for the Lazy Man podcast. It's a hunka burnin' Medicare podcast. A day late and many dollars short, Medicare expert Doug Jones.
Hello, everybody. Welcome to another exciting and thrill-packed episode of the Medicare for the Lazy Man podcast. This is Doug Jones, as my Canadian nephew Drew McMillin may have told you. I am your Medicare expert for today. And I do want to say a shout out to the McMillin family. Overnight, we had another edition. You remember Nora, and then you would remember Mini Max. Well, just recently, little Henry was born to Drew's younger brother. So we now have another McMillin conservative Canadian running around up there. Pretty soon, they're going to be taking over that whole liberal place, and it's going to turn back to the America-loving, conservative haven that it used to be. Anyway, I want to say that in the Canadian healthcare system, there's always a little oddity going on. In this case, the baby was born healthy and happy at 9:50 in the evening, and they were ejected from the hospital by 1 o'clock that night in order to make room for more Canadians having babies and needing the hospital facilities. That's the Canadian single-payer socialized medicine system for you. Here in America, we have mostly private health insurance that precludes that sort of treatment and gives the patients more flexibility, better treatment, better services, and less expensive all around drain on the treasury. And that is freedom of choice and freedom, or the other goal that we strive to maintain is free enterprise. Competition improves everything when it's used properly. So with that said, I'm going to say that one of the ways that I try to help people cope with our Medicare system is to encourage them to purchase my book, Medicare for the Lazy Man. Current edition is 2024. I just received a message from Bill who asked me, 2025 edition, ? When will the 2025 edition be out and available for purchase? Thanks, Bill. I don't know if he's a listener or not, but I'm going to answer him now and in writing. This year, the government was late releasing their figures and their charges for 2025. I just got them about a week ago. I'm trying to wrap up everything so that I can write the new book. Looks like it's not going to be available until late December at the earliest, because this is the year I also have to renew my Arizona license, which involves all kinds of continuing education courses. Plus, we're in the middle of AEP, annual election period. So there's way more going on than I'm prepared to deal with. But Bill, I will get that book out as quickly as I can. It just won't be as soon as any of us would like. For the rest of you, I would suggest going to barnesandnoble.com or amazon.com, typing in Medicare for the Lazy Man 2024 into the search window, and you're going to have the most complete, recent, and up-to-date version of a tool that's going to help you cope with and conquer Medicare in the United States. If you're a Canadian, I wouldn't bother doing this. But if you're in the United States and you want to know about Medicare, because retirement time is coming for you, or you're age 65 and you have to get your own Medicare health insurance, this is the tool you need to conquer and master the Medicare system. After reading it, which isn't going to take you very long, you're going to become a Medicare expert, more so than you ever could have predicted. And those of us who will watch your success and enjoy sharing it with you will be applauding as you say, aha, I've read the book. I now know everything I need to know about Medicare. So please, by all means, do that. And you'll find my contact information within that book. When it's time for you to purchase your Medicare supplement and your drug plan, Nobody can help you as well as I can. Well, maybe other people can, but I'm going to take that position for now. Contact me by email, and I will add you to my list of happy clients. And before you know it, Medicare will be in your rearview mirror, and you won't even have a second thought about it. It'll be something that you think about once a year, maybe, and always with a smile on your face. Speaking of smiling, wow, Randy Carson looks like a happy camper today. Hello, Randy. How are you doing?
I'm good. How are you, Doug?
I'm just fine. I'm glad to be here on the right side of the dirt for a change. You know, you worry about being on the other side of the dirt.
Well, yeah, I know that crosses your mind every once in a while, but hey, congratulations to the McMillins up there in Canada for
Yeah,
the
they're
new little McMillin.
yeah, they're just popping them out like crazy, and they all kind of look like each other too. So
Well,
it's going to
there's a reason. There's a reason for that, Doug.
yes, there is, and it's going to be easy to spot them at the family reunions. We're thinking about going to Destin, Florida, in April, and we're getting everybody together. So we'll have to add some more space to our rental facilities, I guess.
You know what? That story you were telling about, they checked in at 10:30 and they were out of there at 1 or whatever the hell the
Yeah,
name of it.
yeah, it was
You know
about
what that
that bad.
you know what it reminded me of?
No, what's that?
Okay, you know how my mind works in strange ways.
I yes, I'm painfully aware of that.
So I envisioned the McMillin family, the McMillin clan, showing up at the hospital to check in, only they were checking in to the cafeteria. And
Well,
so essentially the delivery facility was like a cafeteria, and they got a tray, and they're going down sliding their tray down the deal, and by the
yep.
time they got to the cashier, there was a baby, and
Uh-huh.
they had to pay and go.
Well, that's about the length of time they were there. If it had been a long, slow line at lunchtime, that's about the amount of time they had to get to the hospital, deliver the baby, make sure everybody was okay, and then get the hell out and make room for the next people. That's the
Well,
Canadian.
I am just excited for the McMillans. Congratulations, and we'll be looking to buy a new little headset.
Absolutely. We're going to need to get them all in the same room when we can, all in the same studio, and let them talk to the extent that they're able to talk. I will say that the other Canadian run-ins to this, McMillan family has had with the socialized medicine in Canada. People down here in America don't realize what a huge problem it is. And I don't understand why Canadians are such wimps that they don't stand up and say, enough of this. We want to return to free enterprise in our medical system. But our proud new father, Robbie McMillin, was delivered on Christmas Day because they had to schedule his birth on Christmas Day because the facilities were all, spoken for all other times. So my sister had to have labor induced instead of letting it just occur naturally. So that was probably 30 years ago. And then the other thing is that the father, the my sister's husband, who I shouldn't really name because this is almost an illegal act, but his parents were medical doctors. His mother and his father had a clinic. His aunts and uncles were doctors in this clinic in Toronto, or Barrie, actually, north of Toronto. And he had horrible back problems. He came to visit us one Christmas and basically laid on the floor the whole time because his back was killing him. So he needed an MRI in order to find out whether there was any sort of surgical solution to his back problems. And he would have had to wait over a year for an MRI to be done. And how long does that take? An hour? You lay in the
Oh,
machine.
25 minutes at the most.
Well,
And half of that's getting you into a a damn hospital gown.
well, there you go. And that's never the most pleasant part of the whole process.
That's
Well,
where you get really cold in the back. I don't know why. Does that happen to you too? Really cold in the back, especially in
I
Canada.
fortunately I've never had to wear a hospital gown. But anyway, so he found his only solution to having to wait a year with horrible back pain was, I think, a bottle of wild turkey. And that convinced a Medicare or a MRI technician to make a little place for him in the queue, as they would say.
In the
So,
wild turkey queue.
yeah, well, there you go. So I'm saying that Canadians have a really crappy system. Sure, they save a lot of people, but how can you not? I mean, you can do that by accident. The thing is everybody well served by the system? I don't think it is.
No. The answer to that is no.
Yeah, that's right. Hey, let's serve our listeners. Why don't we? By showing them.
We got to pick a number.
We
haven't picked a number yet.
We've got a Medicare Advantage Minute coming up. We've got to read an article about Medicare Advantage in order to warn our listeners that Medicare Advantage might be a poor choice if they're
that and stay out of Canada also.
Well, yeah, let's add that to the list. So, Randy,
if you want to see how bad Medicare Advantage is, check it out in Canada.
Yeah,
I'm going to pick my number. Are you ready?
I am.
19.
Oh boy, oh boy, oh boy. 19. Oh, that's an interesting looking article. So I'm going to find number 19. I'm going to cross it off the list. I'm going to get the article out of the stack, put the clip back on it, and we'll put this away for another day. Let me see what number 19 has to say to us. It is printed on paper that I scavenged from a banker's box in Wayne, Illinois. Do I sound like Funkin' Wagnall's porch? This paper is so old and smelly and yellowed that I'm surprised it didn't get stuck in the printer. But I have, it's a list of members of the Dunham Woods Writing Club, I believe, on the back of this list. And God knows how old. I know how old this is. This is from the 50s because there are no zip codes on these addresses. It's interesting that I would be so cheap as to save all this crappy used paper to print on. But anyway, number 19, is Medicare Advantage a good deal for enrollees? This is an article that was published in August of 2024. Randy's he's given himself whiplash, shaking his head no. But I'm going to read the article and see if it's possible that there's some good news for Medicare Advantage participants buried in this article. Perceptions of affordability don't show an advantage to Medicare Advantage, say former and current leaders of the Commonwealth Fund. So those investors apparently have done some studies, and they say that there is no particular advantage to Medicare Advantage plans. Medicare Advantage has grown in popularity for many reasons: low or zero premiums, the appeal of a one-stop shop for benefits compared with juggling Part D as in Delta, Medigap, and all the other elements that you might want to put together if you're building your Medicare supplement plan. The supplemental benefits such as dental and vision coverage, according to KFF, a kind of a lefty think tank, 54% of Medicare beneficiaries were enrolled in Medicare Advantage this year, and the Congressional Budget Office projects that proportion will increase to 64% in 10 years. But an opinion article published today in JAMA, the Journal of the American Medical Association, these doctors cast some doubt on whether Medicare Advantage coverage makes healthcare more affordable than traditional Medicare for Medicare beneficiaries. Multiple surveys show that beneficiaries find care no more affordable in a Medicare Advantage plan than in traditional Medicare, they say, and they call for further research into the issue. These two doctors cite results of a Commonwealth Fund survey to make their case that Medicare Advantage holds no apparent advantage to traditional Medicare when it comes to affordability. For example, they cite the Commonwealth Fund survey results published last year, 2023, that showed that a slightly large proportion of Medicare Advantage enrollees had problems accessing care due to costs compared with traditional Medicare Advantage enrollees, 41% versus 35%, and that stratifying by income did not make a difference. They shared other survey results that paint a similar picture of affordability being a problematic part of Medicare Advantage plans, although there was a divergent result for people who are eligible for both Medicare and Medicaid. Medigap, which is Medicare supplement, those terms are synonymous. Medigap coverage can, of course, make a big difference in how people with traditional Medicare experience healthcare costs and out-of-pocket expenses. Citing a Medicare Payment Advisory Commission, MedPAC, I've heard about this organization. I don't know exactly what they do, but it's a big part of the government Medicare behemoth. Citing a Medicare Payment Advisory Commission report that came out earlier in 2024, those same two doctors said the minority, 41% of those with traditional Medicare coverage, have Medigap plans. And they acknowledge that for those who cannot afford the Medicare supplement or Medigap premium, or they cannot get a policy because of underwriting and pre-existing condition restrictions, they may find health care more affordable under a Medicare Advantage plan. They also note that pluses, Randy's getting his whiplash. He's shaking his head like a banshee over there. They also note that pluses of Medicare Advantage must be factored in with the shortcomings, which health and quality of life benefits of supplemental dental and other benefits for those that use them. This is not written as well as I would like. Anyway, they offer some possible explanations for people in Medicare Advantage plans having problems with health care costs. Provider networks may seek out-of-network care that has high out-of-pocket costs. Delays in care because of prior authorization and other techniques for managing care. That's what they call the plans, managed care. They manage your care, not the patient. These plans may result, these techniques may result in some enrollees paying for care for out-of-pocket costs. Although Medicare Advantage plans have limits on out-of-pocket costs, in 2024, the out-of-pocket limit is $8,850 for in-network services and $13,300 out-of-pocket limit for in and out-of-network services combined. Many people may not reach those limits. These two doctors also say that unmeasured patient characteristics, perhaps related to income, could also explain the lack of a major difference in the perception of affordability among Medicare Advantage enrollees and those who stay with traditional Medicare. They note, though, that Medicare Advantage enrollees cost the federal government about $2,500 more on an annual basis this year than people in traditional Medicare. An assertion also based on the report published in March of 2024. With that higher cost and the requirement that the plans are supposed to use those extra monies to reduce the enrollees' expenses, one might expect the perceived affordability of care to be greater among those enrolled in Medicare Advantage plans to be greater than those in traditional Medicare. Boy, what a poorly written article. I like the bottom line, but I don't like the way those sentences are constructed. And I do like the way commercials are constructed. Commercials contribute mightily to our Christmas fund, and Randy and I are counting up the days until we have our Christmas party, and we're hoping that when we break that piggy bank open, we're going to find some lots of shekels in there, contributed by the commercials like the ones you're about to hear right now. Oh boy, I can just hear the coins dropping into the piggy bank. Not too long before we get to break that thing open and see whether we're going to have a party or just sit around and look at each other like we have so many other years. And I'm hoping that the audience can stick with us through those commercial breaks, because we appreciate the contribution they make to our eventual celebration of Christmas. And just as we did with the last episode, it is time to share some of the correspondence that I get with clients and with potential clients. I would say clients people who want to be clients. I'm looking at my neighbor walking by outside. He's all bundled up against the Arizona cold. It's 62 degrees. Oh boy. Yep, 62 degrees. He just came back from California. I hope he's in a warmer part of California over the weekend. So, hi, Doug. I appreciate your helpful updates. This is from Jim and Jill, I think. And they have a question. They have a question about the supplement. When is it wise to change companies, Medicare supplement companies? We talk a lot here about changing Medicare prescription drug plans, PDPs, because those plans can change from one year to the next, and they can increase in cost or decrease in cost, and they can change their formularies. So if you've got a plan during the course of a year and it's performing well for you, you want to make sure that that plan is not going to change in a negative way that's going to make it an unpopular or an unpleasant choice for you the following year. But we don't ever hardly talk about Medicare supplement plans, because the only changes Medicare supplement plans make are to conform with the new Medicare regulations that are going to be imposed in the coming year. So when Part B deductible increases, your Medicare supplement plan will acknowledge that. When the high deductible out-of-pocket limit increases, your Medicare supplement plan will take that into account. If they make any other changes in Medicare, your Medicare supplement plan will comport itself with the new regulations. And those are always announced towards the end of the year. As I mentioned earlier in this episode, that's what causes me to wait to write a book each year until the government makes those announcements. So anyway, they said, question about the supplement. When is it wise to change companies? We have had United American High Deductible since 2021, I think. This year, there are two of us. No, wait a minute. Let's see. This year, there are a number of plans that are less expensive, maybe a savings of about $20 a month between the two of us. Now, we're all individuals in Medicare, so I think what he's saying is there's probably about a $10 difference between what they're currently paying and the cheapest Medicare supplement plan they found in their area available. So $20 for the two of them. I thought I remembered you saying that we need to check drug coverage every year, but we really didn't need to check the supplement plans. What do you think? Thanks so much, Jill and Mike. And they're in Champaign, Illinois. And here is my answer to Jill and Mike about checking your Medicare supplement plans. And the criteria here is only cost, because all Medicare supplement plans with the same letter designation have identical benefits. They're not going to change their benefits in any negative way at all. So my answer to them is, in my experience, these plans tend to leapfrog each other from one year to the next. Your United American plans may have been the cheapest when you first enrolled, but now some others may not have had rate increases lately, so they're cheaper. Eventually, they are likely to raise their rates, maybe putting the plans you, oh boy, my typing is in need of help, maybe putting the plans that you currently have back into the winner's circle. Add to that the fact that we live in inflationary times, and these companies often respond differently to the same economic conditions, and you have a kind of an unpredictable situation. I guess my advice would be, if you get really irritated, give me a shout, and we'll see if I can get you into a better price. Thanks for writing. And that was my response to their sincere question is, are we being ripped off? Is our premium so high that it's time to examine changing to a different Medicare supplement plan? And the implication I tried to make was, it's hard to predict. I sold you United American, a terrific company, excellent customer service, no reason to be concerned. If their prices are a little higher than the competitors, I don't expect that situation to be permanent. Another correspondent came in. His name is Darrell, and he is, I believe, let's see what he has to say. I entitled the episode of the podcast, "A Great Day for Trump and Many Great Days Ahead for America." So Darrell wrote with that in mind. He said, what are your thoughts on Plan B? This is a gentleman who is thinking about becoming a client, but he hasn't pulled the trigger on it yet. And he said, what are your thoughts on Plan B of Medicare supplement versus Plan G for Medicare supplement? Now, Plan G is the most comprehensive coverage available. Plan B is not quite so comprehensive. And so I said, hello, Darrell, thanks for writing. I try to simplify Medicare, so I concentrate on Plan G, the most comprehensive protection, and High Deductible Plan G, the most cost-effective protection. Plan B, as in Bravo, is somewhere in the middle. If you never plan to travel to a foreign country, and if you're not likely to be using a doctor that charges the Part B, as in Bravo, excess charge, then Plan B might be okay. But I have not noticed that the premium is very much cheaper in most cases. And then he wrote me back and he said, thanks. What about Plan H versus Plan G? And that set my eyeballs to rolling around in my head, because I had never heard of Plan H before, and I had to get out my big old chart, unfold it across the dining room table, and I got my magnifying glass out, and I'm looking. And then another email from Darrell came in, and he said, sorry, I meant Plan N versus Plan G. Oh, well, there you go. And so I said to Darrell, I was going to suggest that you buy Plan H right away, the rarest Medicare supplement plan ever, because Plan H doesn't exist. Maybe it used to years ago, but it sure hasn't existed since I've been around. So anyway, my response to him was Plan N is getting a lot of press. Now, Randy has Plan N, and he likes it very much, and a lot of people do have Plan N. But I'm going to have, this is where Randy and I have a friendly difference of opinion, but Randy didn't know me and didn't know my philosophy when his very intelligent staff got together, had a big meeting, and selected Plan N for him. So it's worked out very well for him, and they flipped a coin. Okay, well, that was their search criteria. But Plan N is getting popular because it's a middle ground between the more expensive Plan G and the very unexpensive, the very less expensive High Deductible Plan G. I encourage people to consider High Deductible Plan G, but the agents and the companies who want to retain the highest possible commission and the highest possible premium dollars inflow will always suggest Plan N, and they totally ignore High Deductible Plan G. I say if you're going to go from the very expensive Plan G to a lesser cost product, I would say you're going to be better off skipping Plan N and going right to High Deductible Plan G, because as the future unfolds, as the years go by, a plan is going to go up in cost. A plan is going to have every year, at least typically, ratcheting increases in premium. If you start at a higher premium, like Plan N is going to be, then you're going to get a bigger increase. If you start with a lower premium, like High Deductible Plan G, you're going to get a smaller increase. High Deductible Plan G still provides excellent protection, but there's just some out-of-pocket costs that you have to pay, which is your price for having a very inexpensive plan. So my suggestion to people is that Plan N is a weak and temporary solution if you're trying to accomplish a savings from Plan G. Now, people like Randy, who never had Plan G and never complained about the cost of Plan G, they live in la-la land. They don't know any better, and that's fine with them. Everybody's happy, and life is beautiful, and we just have flowers and candy all day long. But if you're trying to escape the increasing premiums that a Plan G is imposing on you, Plan N is a temporary solution. High Deductible Plan G should be your ultimate solution. So that's for Darrell. He actually then went to the website and filled out a questionnaire, and he has requested some quotes. So I'm going to show him the cost of Plan G and High Deductible Plan G and let him decide whether he thinks my suggestion to buy High Deductible Plan G is a wise one. Ooh, now we've lost some correspondence. We've got an article here. Some ladies are bowling. All these insurance companies put out articles about things that have to do with, as one person on the back of the current book said, seniors are maniacally grinning at the prospect of being on Medicare. And so these happy women are bowling. And the headline here is Medicare open enrollment from October 15th to December 7th. It's really not open enrollment, it's annual election period. On reviewing 2025 coverage options, get the ball rolling on reviewing 2025 coverage options. This is telling you that if you have a Medicare plan and you want to see what your drug plan options are for next year, you better get on the stick. You better get moving. Have you compared your Medicare coverage options for 2025 yet? Don't let this chance roll by. Visit medicare.gov/plan-compare before December 7th to review your current plan's costs and benefits and how they might change in 2025 and how they will compare against other available options. Tip: log in for a more personalized experience and add your prescriptions and local pharmacies to get a better estimate of your prescription drug costs. Here are some things to consider while you're comparing those prescription drug plans. Check that your prescription drugs are covered and that your doctors are in network before enrolling in a plan. I take issue with this, but I'm going to read the other two hints that they have, and then I'm going to tell you why I think they're a waste of ink. Number 2, look at the plan's deductible and total drug and premium cost as an estimate of your total cost. A plan with the lowest monthly premium may not always offer you the lowest total cost. And number 3, think about what benefits matter to you. Some plans offer extra benefits like vision and hearing, or now that's not true. That's for Medicare Advantage plans. Some Medicare Advantage plans offer extra benefits like vision, hearing, or dental coverage that could help meet your needs in 2025. All right, so I'm going to go back. Those 3 hints, throw them right out. What you're doing is you're a person who is smart enough to have a Medicare supplement plan. You're looking at your Medicare prescription drug plan, which you need even if you don't take any prescription drugs, because you don't want to have a lifetime penalty imposed on you for late enrollment down the road if you decide you need one of these plans in a few years. So what you're going to do is everything right up to that point was accurate. Go to medicare.gov/plan-compare, put in your zip code, put in, click on the little circle that says, I want a drug plan, and you're going to find the prescription drug plans lined up for you in order from cheapest to most expensive. And your goal is to get the cheapest one that covers your drugs at a price that will be palatable to you. In other words, it'll be the lowest out-of-pocket cost for the year. After comparing your choices, if you're happy with Medicare coverage you have now, and if it's still being offered next year, you're all set. If you decide to make a coverage change, your new coverage will start January 1st, and you may push the button right on that website right there under the name of the new plan that you think is going to serve you better. It says enroll. I think it's a green button for each of the drug plans. Push that green button and it'll ask you a few nosy questions like what your social security number is, what your bank account information is, and pretty soon you'll be lined up with a plan that's the best available for you in 2025. And what's the best available for us right now, Randy? Probably wrap this thing up and send everybody home, huh?
We have no quarters left, Doug.
Well, it's a perennial problem. I don't know quite how to solve that.
I don't know what to do about this, but given the fact that I need to land the plane or bring the bus into the station, I'm going to do a few things that I always do to do a wrap up. Grab your pencil. You can reach out to Doug at the email address of dbj@mlmmailbag.com. Do not forget, he is licensed nationwide to help you with your Medicare supplement planning. Check us out at the website, medicareforthelazyman.com. We would appreciate it if you could drop a review for us in your wanderings through the wilds of the internet. The numbers mean it all in our business. Thank you for joining us. You could have been anywhere else doing anything else, and you weren't. You were with us spending a little bit of quality time with Medicare for the Lazy Man podcast. But if you weren't watching your watch, and nobody ever does, I don't know why, you have just spent about 32 and a half minutes with Doug Jones, the anti-insurance guy from Oklahoma originally. Now he's back home in Cave Creek, Arizona. And I probably should tell you that he's got an oxygen mask on today because his fortress of solitude has risen higher. It's risen higher up the Nosebleed Mountains. I don't know how that happens, but I'm gonna put you in at 13.5.
Well, I'm glad I brought my parka back from Wayne, Illinois, because I need it up here. The oxygen and the parka will both save my life. Anyway, I hope our little efforts here will be entertaining for you. Please come back and join us again for our next episode. It won't be that far into the future, and we'll look forward to having you then. Bye-bye.